Hi, my name is Ashwin Rao, and I'm the Program Director of the University of Washington Sports Medicine Fellowship. I wanted to take this opportunity to welcome you to our program. You're taking a look at our program during a very exciting and novel time in the history of the United States as well as in sports medicine as we have to manage the situation around the coronavirus pandemic as well as a variety of other societal changes and challenges that are presented to us. And so we are doing interviews this year using virtual techniques such as the Zoom interview platform. So it'll be different this year. We usually like to get to know people in person, but in this situation, as the situation dictates, we won't have that opportunity to do it other than via virtual technologies. So I wanted to take this opportunity to introduce you a little bit to the program. This would be what I would talk to you about when you arrived. Our program is an incredibly intense, dynamic, and exuberant opportunity for our fellows. And I think most of our fellows come out both invigorated, excited, and maybe even a little bit exhausted at times by the number of opportunities presented to them. We now have a collaboration with Seattle Children's Hospital and have two fellows, including one that will have trained in either family or internal medicine, and a second that will have trained in either pediatrics or med peds. So know that we have two tracks that have two separate match numbers and that share numerous resources as well as many teaching opportunities. I am the program director of both spots. There is also a separate PM&R sports program with a separate directorship, though we do spend some time with our PM&R colleagues in the academic setting as well. So we have a large dynamic group that I think we all have a really great fun time learning from. We have a total of 12 CAQ'd sports medicine faculty, including 7 here at the University of Washington and 5 at Seattle Children's Hospital. My associate program directors are Dr. Dave Siebert and Dr. Kyle Nagel. Kyle was the individual who was really responsible for driving the pediatric sports medicine program forward and creating this opportunity, and I think it's a great opportunity to open up new resources and new venues to provide both of our fellows with a wonderful opportunity to learn in a more diverse clinical environment. We teach a number of interventions as well as diagnostic procedures. So whereas many programs will teach you the nuts and bolts of joint exams, sideline medicine, joint injections, and a wide variety of other opportunities, we also do those types of things, but I try to practice from a base of providing patients and my fellows and role modeling with my fellows the core concepts of primary care in the sports medicine setting. I think that's really what distinguishes a primary care sports medicine physician from one of our other colleagues is some of the training that you receive in your primary care discipline. So don't let that go. At least my philosophy is such. That being said, I think that it's important to help provide a training that helps define our fellows in their own careers in manners that they may not otherwise be able to do. So that includes getting the 150 or more diagnostic ultrasound evaluations, and we have a very robust ultrasound curriculum here at the university. Further, we teach a number of diagnostic ultrasound and procedural ultrasound techniques, including percutaneous tenotomy done under ultrasound guidance. We use a procedure called 10X to do that. We also teach radiofrequency ablation of genicular nerves for chronic knee pain related to arthritis. I do peripheral nerve hydrodissections for both diagnostic and therapeutic procedural assistance. We do autologous growth factor therapy, such as platelet-rich plasma and other similar methodologies to try to provide opportunities for a patient who is stuck between rest and rehab and maybe the choice of surgical intervention and providing them with another opportunity to explore their care. I think of that in the framework of providing patients with another opportunity to have something to hold on to and to hope that's not just simply rest and rehab, shut it down, or go have a major surgery that takes them out for a long period of time. So I think it's really fun to work with our patients and have this dynamic interaction with them to involve the fellows in that process and really further their care. Our fellows also get terrific Division I or high-level athletic care experience. In a typical year, our fellows are working with University of Washington Husky Athletics, so that's really the purvey of our family med track. Our pediatric fellow works with Everett Community College, which is a really great feeder for a number of Pac-12 programs. Um, our pediatric fellow also has a great opportunity to help take care of the Seattle Seawolves, which is the professional rugby club in town. Our faculty group also works with the OL Reign Professional Women's Soccer Club, and our fellows have some involvement with that as well. I work with the Brooks Professional Running Club as well, so middle distance runners who are competing at the Olympic level, and our fellows are involved in their care as well as the situation presents itself. We work with some elite dancers, we work with local area high schools, and we have a focus on underserved care too. As you're well aware, there's a number of social dynamics that have now been really exposed and are being further explored. And at the beginning of our spring season, we took the time to form an equity, diversion, and inclusion statement that really tries to embrace the concepts of trying to promote equity, diversity, inclusion, and support and promote anti-racism at our program as well. So I think that those are all very important topics to embrace, both in how we look at who we are training, so in the recruitment process, but also in the opportunities that are presented to our fellows to explore those avenues for providing care. For example, our primary care clinic for our family medicine fellow is at the Harborview Care Center now, which is underserved clinic. Their high school experience is at the Cleveland High School site, which is a primarily Latino, underserved, underrepresented population that we now have an opportunity to provide better care at. There's a number of initiatives through Seattle Children's involving fair play and exercise for kids of underserved privilege and underserved background in outdoor settings to try to provide some equitable measures for exercise and wellness as well as fitness. So our fellows are involved with that venue as well. We do a lot of community service, including community heart screens around the region, providing free EKG, cardiovascular screens, and even echocardiograms to populations in high schools around the region. Our fellows are also expected to perform research as well as a QI project during their fellowship year. So I think it's really important to understand that there's a lot of different opportunities here. Our goal is to train and support leadership and innovation in the field of sports medicine. And really, as a number of us have been involved in leadership at the American Medical Society of Sports Medicine, we believe that that provides additional opportunities for our fellows and graduates of our program to explore and to continue to influence the future of sports medicine and the future of sports medicine training. So we believe in training leaders. We believe in supporting the interests of our fellows and molding the curricula to their specific interests as well. I personally am really interested in people who are a great fit for our program, but also making sure that we're finding opportunities to support communities that may not have sports medicine providers or access to date, and finding ways to explore that space as well. So thank you for taking the time to look at our program. There's so much more to learn about and to speak about. We have a ton of information on our website, and I really look forward to having you explore that and hopefully have a chance to get to know you a little bit better through the interview process. Thank you so much. Have a great day and stay safe.